Hi guys, welcome back to my channel. My name is Cresha Nicole, and if you are new to my channel, don't forget to like, comment, and subscribe. Hit the notification bell if you want to be notified when I upload a new video. Please go back and look at my previous videos if you have a chance. One of the videos that I'm asked about a lot, asked to do a lot or asked about a lot is my nursing journey. I've already posted it, you guys. So please go back to my previous videos and look for my nursing journey, CNA to nurse practitioner, NP. So I wanted to make a video about how to deal with difficult patients and difficult family members. Woo, Chile. Let me tell y'all something. In the field of nursing, you are going to have to deal with difficult people. And I mean, people will bite your head off. Period. Bite it smooth off. And you have literally met them like 2 seconds ago. I experienced that a lot working in the ER. I actually just went through this yesterday as a nurse practitioner. On the phone, this lady was livid. You hear me? She was livid. So I used to be really shy, so it's easy for me to deal with difficult people because I just backed down. I mean, I just didn't, just very non-confrontational. I was very upset about it, you know, but I didn't say anything. Then I went through a phase of, you ain't gonna talk to me like that. Period. Like that was my attitude. Like, who you think you talking to? So I had to fix my own attitude because that would get you nowhere. Luckily, I was not fired, but you know, I'm a big person on you teach people how to treat you. So when you allow people to constantly treat you badly, it is sending the message that I'm allowed to treat you badly. And I just had to. I was so tired of people treating me like crap, so I got a little bit too hard. But in my experience, I've realized that a lot of times when patients and family are rude or just mean and aggressive at that moment, it's because something is going on that has nothing to do with you at all. It has nothing to do with you. So when you have these experiences, first of all, think about where you are. Are you in the ER? Are you in ICU? Are you in a med-surg unit, long-term care? I don't care if you're LPN or RN. Where are you? 9 times out of 10, you're in a place where this person, this patient does not want to be. This family member does not want to be. You are seeing them at one of the worst times of their life. So, especially in the ER, you know, these people are really hurting or really sick. They don't want to be there. They don't want to see me. So whenever they act that way, I think maybe this has nothing to do with me. This is me seeing them at their worst, you know, especially if it's the patient. I don't really have much understanding for when family members are overly rude or aggressive or sharp, if I'm not giving that to them. And I don't give that to people. Like if I walk in a room, I'm going to walk in speaking, hello, how's everyone, whatever. So if you do get that energy, try your best not to give it back. Also you can correct people without being rude and unprofessional. Give them a chance to speak. I know that feels like giving away some of your power. I get it. But give them a chance to finish their thought. When they are done, then express yourself in the most calm, professional way possible. 9 times out of 10, that works. You can explain yourself and people will listen if you first give them a chance to speak. So I started doing that and letting them kind of let it out. Because sometimes they just need to let it out, and it's not you as a person or you that bothered them, but it's just the life and the circumstances that are making them act that way. So, for example, yesterday, you know, I'm a nurse practitioner now, so it's a little different from what some of you guys may experience, but At the end of the day, I'm still a nurse, and I still get chewed out. So this lady called about me not prescribing a particular medication for her child, her teenage child. So I let the lady give it to me on the phone. And before I even had a chance to be like, ma'am, you know, blah, 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 she was like, I'm not mad at you. I'm just, you know, she was really upset because, you know, the person she sent with the child, which is the father, didn't really say what she told him to say, which I would have needed him to tell me in order to treat the patient appropriately, but he didn't do it. For whatever reason, maybe he forgot, maybe he had something else on his mind, maybe she didn't say anything because she didn't want to say anything in front of her dad, who knows. But the mom was really like screaming on the phone, really upset. And once I calmly explained what happened, she, you know, was apologetic. And this happens all the time, especially when I worked in the ER as a RN or regular nurse. So I would get people that would just spaz out. And then if you stand there and just look at them with the most blank of faces, sometimes they'll realize maybe I'm cutting up a little bit too much, and they'll relax a little bit. You have to have thick skin. You have to, because you are being critiqued from the moment you walk in the room. Everything you say, how you appear to them, everything, before you even have a chance to mess up something. You know, hopefully you won't, but even before you have a chance to mess up, you're already being judged. You have to have thick skin and be confident in yourself as a nurse or nurse practitioner. Know, okay, I didn't do anything wrong. I didn't mess that up. So don't take too much of it personal. That's just the nature of the beast. You're gonna come in contact with people that are just a-holes, and they are, and acknowledge that it's not you all the time. Now, if you did mess up and you caused this person to be upset, try to apologize, explain yourself, and correct it, fix it. What can I do? You know, and speak to them as if you would want somebody to speak to you, because you still have to have your job. I mean, you have to have your job, and you have to be aware of the type of company you work for. If you don't work for a company, or you don't have a supervisor that's going to have your back, and they're always going to side with the patient, they're always going to side with the family, even in times when that family or patient is wrong, then you might want to, number one, probably find a better environment to work in. Number two, you might want to just bite your tongue and learn how to do that, and not take it home and be upset with everybody and you know, mill over it for a while. So I hope that helps you guys. Try to stay positive, because a person who is fussing at you and being an asshole looks really stupid when you're not doing it back to them. They really do. They look stupid to everybody in the room. They look stupid to the patient. If it's a family, they look stupid in front of the patient. And I've had patients be like, don't listen to them. Just, you're doing just fine. And it happens. It's most likely the family members who think they have some medical knowledge, which is a shame, because if they work in the medical field, they should know what it feels like to be chewed out for no reason. So have thick skin, try to be positive, and don't take any of it personal, because it's probably not about you. Hope you find this video very helpful. See you guys on another video. Bye-bye.